Hello and welcome to this brand new episode of Newsmakers, the show where we bring to you successful stories of inspirational people from all walks of life. Because at Newsmakers, we aspire to inspire you. My dear friends, I'm your host Simran, and on today's episode, I bring to you a trailblazer personality who is the advisor of Pharmaceutical and Biotech sector. He is working diligently in this field and coming up with a lot of transformation in the society. So we are so proud to bring him here on our set of Newsmakers, and we are now going to announce his name. He is Mr. Ankit Shah on the sets of Newsmaker. Please allow me to welcome him. Hi Mr. Ankit, we are so proud to have you here with us.
Hello Simran, it's an absolute pleasure and I'm really looking forward chatting with you.
Yeah. I been conversing with you behind the camera as well, and I have a very important question, that what drew you towards pharmaceutical and biotech sector, and that too in a country like India, where there's a lot of things which are happening. We really want to hear it out from you.
Thanks Simran. So my foray into the pharmaceutical and biotech sector wasn't accidental. Growing up in India, I witnessed firsthand the health disparities. And seeing such disparities, with people that I live and surrounding me, I think it definitely posed that curiosity in me, and to kind of learn more about what the healthcare system of India is. And I think that curiosity led me to kind of foray into studying pharmacy, and then doing my research, in the US in health outcomes. So it has been a kind of a constant evolution, but it stems right from the childhood, looking into the overall landscape of healthcare in India.
So you have always been working with the pharma companies, the giants in this industry, and that too globally. So where do you see India evolving to?
That's a very relevant question. So the way that I see, I think, working with these behemoths in the West, I see that they are led by innovation. They are led by, patented, branded medication as a system. So, when I look into India, while it has cemented its position as the, generic hub in the world, but we have some more strides to go in trying to establish ourselves, not only in the generics department, but try to kind of establish an infrastructure where we are also, developing our own novel discovery of drugs. And I think that is what, if I have to kind of sum it up, US is at the forefront of innovation. Europe, if you look, they have made strides in biosimilars, and they also have sizable generic market. And India, so far it has been, the generic hub, but now it's, looking to change that narrative. And we see that there are companies like Biocon who have invested heavily in biosimilars, and they are trying to kind of change that narrative in their own way. So it's been, I would say that from US to India, I think it's a trajectory, and I think that is what I see at this point of time in terms of distinguishing the Indian pharma market compared to the West and Europe.
Oh, wonderful. So Ankit, considering the challenges that we faced historically, it's been there. So how do we see those pathways for future? What do you see? How are we progressing towards it?
Simran, if I look into the most important and critical bottleneck, it has to be the regulatory hurdles. I think our policies are changing, but it is not still conducive to have life-changing medicines and cancer drug treatments accessible in India.
Correct.
And I think that limits our potential in terms of accessing healthcare, not only in terms of the basic infrastructure, but also in terms of availing life-changing medications and treatments. So I feel like that is definitely one of the most critical areas that we need to work considerably. The second I feel is in terms of our distribution and supply chain and logistics. I think we have a great manufacturing capacity, but at the same time we also have to make sure that our supply chain system is also sophisticated so that we are able to provide the same medication to every part of India.
Correct.
And lastly, I believe is the infrastructure in terms of the university-led research translating into commercial success. So what US has mastered over the years is that they have these hospital systems like Johns Hopkins or Mayo Clinic, where all this innovation is happening. They are at they are the backbone in terms of conducting these clinical trials, and I think that is something that we are lacking in India. So we really need to kind of make this framework where academia is working together with pharmaceutical companies, and that has to be into the equation.
That's really wonderful that we have really jotted down everything on point, and we know that we are lacking a lot here, and the way you've told us, we really work, and at personal level I really feel that the rural sector is facing this challenge the most. Is it something that you're doing about it?
Definitely, and I think that is something we want to make sure that affordability and accessibility are just not the buzzwords. And for us to change the scenario, I think Government of India has definitely done a commendable job when it comes to launching programs like Ayushman Bharat,
Right.
where they are providing insurance schemes to about 500 million of our population. And that's a considerable amount of subsect of population. And then there are also other initiatives that are launched in terms of public-private partnerships. But I feel what is lacking is in terms of having an ecosystem which is sustainable for the long term. Okay. So while these initiatives are great, but we have to continue building them so that it's sustainable in the long term, and the results amplify as we look into this transition over the period of time.
Absolutely, absolutely. So Ankit, India's push towards biotech sector, it's quite evident. Now, what are the innovations that we are bringing upon to make a change in this sector?
That's a very good question, Simran. I think what we have achieved over the last 5 to 7 years in the field of biotechnology is discernible. I think the National Center for Stem Cell and biologics like therapeutic biologicals in Pune, they're doing really good work when it comes to stem cell research. We are also seeing that our local startups are now embracing RNA technology, which is right now at the forefront in terms of developing personalized treatments. So I believe that we have started to work our way, and the future is really bright for us. I think what Serum Institute of India did during pandemic was commendable, partnering with Oxford University and creating an alternative, a generic alternative of vaccine, which not only supplied vaccine to India, but it also helped a lot of countries, targeting millions of population outside who could not afford the branded versions of vaccine. So I believe that this is a great subsector within healthcare, and I think I'm really very hopeful and very optimistic about its future.
Absolutely. So are we, that the way you are progressing, the way you are working upon it, and the way we are as a country, we do see that the future is going to be really bright. Now, you know that the dominance of generic medicine in India is too much. Like here, we really emphasize on that. So what do you see as the branded medicine? What is the future of generic and branded medicines in the coming years now in India?
Right. So I think definitely there is an advantage of having access to the generic medicines. Right. We get those same medicines at a fraction of cost, which the branded would be at a very high cost. Right.
Correct.
So there is definitely that advantage. But at the same time, what happens is that we will have to wait, about 20 years or 15 years for that drug to go off patent before we are able to manufacture the generic version. And that limits our potential to manufacture so many life-changing therapies. So I think this interplay is good, but we really need to have a balance between innovation and the generic market. So generic market can continue being the backbone of the Indian pharma industry, but at the same time we really need to invest considerably when it comes to innovation, establishing our R&D infrastructure so that we do not have to depend upon other countries in terms of these therapy, but we become a home base to develop our own set of therapies that are as comparative and as effective. And I think it is also very crucial so that we get those medicines and have access to it in real time, and we do not have to wait such long period in order to avail those treatments.
Absolutely, and this is what really happened towards the COVID times.
Right.
We had to absolutely wait long to get these on point, and So COVID-19, like we just spoke, that how we are dependent on the West. So COVID-19, of course, it emphasized majorly on global interdependence. Now we are in the Progressive India recent summit, G20 summit. This has brought about a lot of changes. But where do you see India evolving after this summit has happened?
G20 was a statement. It allowed India to showcase its commitment to excellence, and I believe with the New Delhi Pathways to Innovation, it is positioning itself not just as a supplier or as a collaborator, but as a leader. Leader who has the position to steer not only policies domestically, but globally. And I think that is what we really need to take advantage of. That now that we have positioned ourselves this way, we want to make sure that the coming decade or so, we are shifting our mindset to be the leaders. And I think for that, we really need to have not just the intent and innovation, but also the infrastructure. And I think with the public-private partnerships that is happening, one I can recall is the BIROC and the World Bank partnership. I think it's a great example that we are setting, that a lot of collaborations and global partnerships are underway. And I think this is going to allow us to witness a sort of renaissance in terms of this healthcare revolution that we have been anticipating for quite a few years now.
All right, so G20 has brought about a great revolution, and like you said, that we are all set to become leaders back again. Like once we were ruling, and India is going to be a ruling country once again. That's what you really feel and wish for as in India.
Yes, absolutely, and I think that's the hope, that we are able to shift this narrative for ourselves, right? But in order to do that, we really need to have this grassroots level of innovation embedded into everything that we are doing. And I think for us to be the thought leaders of healthcare, we really need to start investing considerably in the R&D infrastructure. And so going back to what I was saying, that I think we do have the intent, but I think right now the emphasis should be for a lot of these pharmaceutical companies, like the Lupins and the Ciplas of the world, where they have established themselves as the generic giants. They really need to start expanding their capabilities into R&D and conducting their own having their own innovation hubs, so that they are able to expand into biosimilars or conduct research for the novel drug discovery.
As you are an expert in this field, and with your expertise, there's a lot that you've learned and also developed. So where do you see India 20 years from now?
Right. So I think the Make in India is really good, but I think we also want to make sure that we imagine in India.
Wow.
And that is what I personally envision. With the advent of AI, genomics, we really need to amalgamate this formula where we are having a very forward-looking approach and a mindset, and embedding the traditional components of healthcare. So that shift has to happen with this confluence of leveraging technology to our advantage. And I believe that we have so much of potential. We are starting to do a lot of great work in digital health, but I think what matters right now is to kind of ensure that we develop this ecosystem which is sustainable for long term, but it has all these forward-looking components of AI, of genomics, of data science, and we are leveraging and harnessing technology in such a way that we can have a multitude of capabilities lined up for us to make the most advantage of.
So AI has absolutely brought about a huge transformation, and with this is it also affecting the industry here, the healthcare industry, like you just said? So it is going to bring about a lot of other changes as well. Do you foresee that?
I only see positives with AI because it is not only bringing about efficiency, but it is also giving us the opportunity to simulate a world that we can envision down the lane. So I believe that AI should be completely leveraged to our advantage. And I think healthcare is starting to do that.
Yes.
There are so many companies that are able to kind of decode the entire DNA, leveraging AI and data science, right? So these are really great technologies, and these are really great mediums through which we are able to expedite our process of drug discovery. Imagine there are so many, thousands of molecules, right? If AI is enabling us, it is acting as an enabler to shorten the time where we can identify those few molecules which could potentially be used for, treatments like, cancer or a very targeted therapeutic, then I think
it's going to be wonderful.
Absolutely, yeah.
I really hope that AI comes up with such an innovation that we completely eradicate this thing called cancer from our lives. It is taking a lot of lives at this point of time. So Ankit, now this thing called cancer really puts you into terror. Since you're an expert in this field and providing your expertise to various health sectors, I would be wanting to know what is specific thing done to bring about awareness so that either we can eradicate this term called cancer from our lives. It really touches me to heart. I lost my mom to it. I would want to know that what is the right, how can we take care, or what things to be taken care about in case it is something to do with cancer.
Right. I think it's a very important question, and while great discoveries have been made, but I feel like it's still not nascent, but in a way where we still need to do much more. So I would say that over the past decade, we have the advent of cell and gene therapies. We are leveraging RNA technology in order to kind of create personalized treatments. But at the same time, I feel the scope is too wide and too huge for us to kind of really decode how to treat cancer remission free. What happens is that because the first stage itself, detecting that a person has cancer, often that gets amiss. And so it is much later, in stage 3 and 4, when a person figures out that they are diagnosed with cancer, and I think that is what the gap is, in my opinion. So with I think as I mentioned, with the advent of AI and genomics, I think they're going to play a huge role in helping us identify the symptoms, or whether a person might be symptomatic to be diagnosed with cancer. And I think these are really good endpoints that we can look into in trying to kind of have an early detection, so that we can also have an early treatment.
This sounds really wonderful. Although we also live in this myth that AI has come, it's going to change the world, probably for good. But then And there are times people are also thinking that it may bring out some kind of a negativity to it. But what I really feel, like you just now said, that AI is going to be transforming this way of, getting to know that how it's detectable, the cancer thing in the first stage. So I'm sure AI is going to bring about huge change, and it's going to be all positive. So it's wonderful that we have got to know about it. So during this entire journey of yours, who do you think are the key drivers who are transforming this change in India with the health sector?
So if I have to sum it up, I believe that it's a blend of policy, academia and industry. I think those will be the key drivers leading us to be, one of the more advanced healthcare, which right now is not the case. And I think the dependency is on young researchers, entrepreneurs who should be backed by the government initiatives. And I think this amalgamation, will, hopefully create a formula that will allow us to be more vigilant and be more adaptable in our healthcare ecosystem. And I think this is something that I personally feel would allow us to, shift the narrative and make our, healthcare landscape much better and more progressive in the few years.
All right. I have a very personal question to ask you is, how do you, like you are a person who is like an expert in this pharmaceutical and biotech industry, you're an advisory to them. So you as a person, Ankit as a person, how do you take care of your own self? Like you look in the best of health, in the pink of your health, but how do you manage this work-life balance? Because this is the time of excessive struggles and the negative times. You in such an industry where also making people change their lives. How do you keep up to your life?
I think I personally also have been in times where I've struggled with my mental health. I have struggled with my own health, but I believe that we really need to be more proactive and aware of our health, and we need to not rely in terms of managing our own health. So personally speaking, I feel like diet for me is the most important. I try to kind of watch what I eat, and I'm very strict with my diet, and I do train at least 4 to 5 times a week, which gives me that good time to kind of focus outside of my work.
With you in the entire interview here, I would like to know this last question. Your advice, like you've have an experience of about 9 years serving this industry as an advisor. Now we would want your advice for young entrepreneurs and the researchers. What would you like to tell them?
Simran, as we traverse into this labyrinth of challenges and opportunities, I believe our end game should be clear. To make healthcare accessible and affordable, not just for a subsect of population, but for entire 1.4 billion of us. And I think with blending our Indian ingenuity with global partnerships, I think we'll be able to create a recipe that will allow us to transform the healthcare ecosystem. And I believe that I really hope that this journey is replete with lots of impact and innovation. And I think that is what even I would personally like to strive for.
Wonderful. We've just got a great piece of advice from a person who is working diligently into the healthcare industry. My dear viewers, backstage I had a time to spend some time with Ankit ji, and I got to know the visions that he carries for India. And I'm so honored that he made to this interview here and expressing his views and his visions for future for the healthcare industry. Thank you so very much for being here.
Thank you, Simran.
I'm sure you would have liked this interview, and if you have, then please let us know on the email that is reflecting here. And if you think that you too have a story to share, please do let us know. We will be very happy to host you here on this couch. Till then, Simran signing off with the promise that I will be back soon with another newsmaker super soon. Till then, stay blessed and stay happy.